Now I'm going to talk about the laboratory studies about the immunological disorder. First one is called anti-nuclear antibody test. So ANA shortly called. ANA determination is a blood test used in the differential diagnosis of rheumatoid disease and for detection of antinucleoprotein factors and patterns associated with certain autoimmune disease, right? So ANA test determined or differentiate between rheumatic disease or autoimmune disease. The most common autoimmune disease is systemic lupus erythematosus, or we say scleroderma. So the test is negative at a 1:40 dilution and depends on laboratories. A positive result does not necessarily confirm a disease. Because if patient have a criteria of autoimmune disease, right? So it can non-laboratory diagnosis of the disease. And ANA titer is positive in most individuals diagnosed with SLE, systemic lupus erythematosus. And SLE, it may also be positive in individual with systemic sclerosis or scleroderma or rheumatoid arthritis. So systemic lupus erythematosus, it is the chronic and progressive autoimmune disorder that affect the vascular and connective tissue of the multiple organ in the body. Whereas the scleroderma affect connective tissue throughout the body, and also symptoms include tight skin, or dysphagia is more common, or patient develop edema of the extremities. So ANA test can be false positive in some individuals. Now, other test, it is called anti-dsDNA antibody. So DN means double-strand DNA. So anti-double-strand DNA antibody test is a blood test done specifically to identify or differentiate the DNA antibodies found in systemic lupus erythematosus. So if any patient ANA is positive and also double-strand DNA positive, it confirms he or she have a systemic lupus erythematosus. The test support a diagnosis, monitor the disease activities, and also response to the therapy, and also established a prognosis for SLE. Usually the virus negative should less than 70 international unit per ml by ELISA. ELISA stands for enzyme linked immunosorbent assay. This is the test name. Now, human immunodeficiency virus testing. Usually, if the CD4 T cell count, so first of all, I said, if a patient diagnosed by HIV positive, it does not mean he or she have a AIDS. So AIDS is a disease. HIV is a virus. If a patient is HIV positive, it does not mean he or she are AIDS patient. When we call a HIV positive patient diagnosed the AIDS, when we count CD4 cell. So if CD4 cell is go down less than 200, we call AIDS. So human immunodeficiency virus, HIV testing. So CD4 is a type of T cell. CD4 T cell count, monitor for prognosis of HIV as well. Not only diagnosis. As the disease progress, usually the number of CD4 T cell decrease with the resultant decrease in immunity. The normal CD4 T cell count in between 500 to 1600 cell per liter. In general, the immune system remains healthy with CD4 count higher than 500 cells. An immune system problem occurs when CD4 cell count between 200 to 500 cells. And severe immune system problem occur when CD4 cell is less than 200. And that times we call HIV patient, positive patient have AIDS. Now, continue. So we monitor the progress of HIV by CD4 cell count, also CD4 and CD8 ratio, another T cell. Normal ratio is approximately 2:1, and viral culture involves placing the infected client blood cell in a culture media and measuring the amount of reverse transcription activities over a specific period of time. The viral load testing measures the presence of HIV viral genetic materials. It is RNA. Because HIV is an RNA virus. So when we see the CD4 cell less than 200, severe immune response, and that times your patient turns to opportunistic infection like bacterial infection, mycobacterium, TB. Fungal infection is more common like Candida albicans, yeast overgrowth, like oral thrush, or protozoal infection like pneumocystis developed. Even malignancy like Kaposi sarcoma. What next? So what are the other tests for HIV? We do the oral testing for HIV and also home test kit for HIV. Right? So at a home test kit, a drop of blood is placed on a test card with a a special code number. The card is mailed to the laboratory for testing for HIV antibodies. So the individual receive the result by calling a special telephone number and entering the special code number as well. So it is actually maintain the patient privacy. So if any patient is developed or if any patient is HIV positive or AIDS, how we can diagnose them or what are the nursing management or nursing care. So maintain issues of confidentiality surrounding HIV and acquired immunodeficiency syndrome, which is called AIDS. So confidentiality, privacy is important. Follow the prescribed state regulations and protocol related to reporting positive test results. So HIV patient, when we intervention or when we maintain with them, it is very important to maintain a good diet for HIV and AIDS patient. NCLEX board asks a question, what kind of food is good for them? It is high protein, high calories, and liquid, enough liquid. Also keep it note, liquid give before the meal. Also decrease the residual interdisciplinary approach needed. Supportive groups can help them. Because HIV patient opportunistic infection is more common. And also, if patient is untreated, does not maintain or did not take enough medication, malignancy is more common. Most common, Kaposi sarcoma, non-Hodgkin lymphoma, or cervical cancer. Next here, we are going to talk the skin testing. So, first of all, the administration of an allergen to the surface of the skin or into the dermis, also admin by patch or intradermal techniques. So if a patient needs to do for skin test, what are the pre-procedure, what are the post-procedure? So pre-procedure, we discontinue the systemic corticosteroid if your patient take it. Tell them not to take it. Antihistamine, better to stop 5 days before the test or as prescribed. Ensure informed consent has been obtained. And post-procedure, we record the site, date, and time of test. Record the date and time for follow-up site reading. Also have a client remain in waiting room or office for at least 30 minutes after the injection to monitor the adverse effect. So it is a chemical or dye injected inside the body. So after the test, it is very important to tell your patient to stay inside the clinic or hospital for next 30 minutes. We observe develop any kind of adverse or side effect. Inspect the site for erythema, papules, vesicle, edema, or wheal. Also measure the flare around the skin rash, or we should keep the documentation about the skin lesion. Provide the client with a list of potential allergens. And also, it is very important, resuscitation equipment should be available there if the skin test is performed before, may induce the anaphylactic reaction. So sometimes some of the patient chance to develop anaphylactic reaction. So we have to be prepared to protect the anaphylactic reaction.